And after about 10 to 12 years in practice, I was getting very good results on a lot of physical problems, but noticing that things were coming back. And so I started to question what was missing for me.
We cannot separate the mind and the body. It's all one. And the mental health, our physical health cannot be separated from our environment. So whatever our experiences were in our earlier childhood can be still influencing what's happening for us today.
So acupuncture for me started when I was actually quite young. Around 13, 14, I was into martial arts and Taoist philosophy. Both my parents were quite ill at that time. I was sort of shocked by the way that they were treated by the Western medical profession of. So when I was 20, I started looking for to go into the healing arts, and after studying different pathways, different avenues, I looked at shamanism, I looked at osteopathy and Chinese medicine. And the one that was really most accessible, seemed to be the most complete to work on many different levels for me was Chinese medicine. I worked with many different teachers because I've realized that what I was learning in acupuncture college wasn't enough. And then I started to find that we had all these different types of acupuncture, but there wasn't a way of understanding how they all work together. And then I started teaching my understanding of how channel interactions, holography, and needle point families is what I call them. And so that's what the background for creating the UAT, Unified Acupuncture Theory System was. What I've noticed is that the Chinese medicine that we study is very much based on how humans were living in Middle Ages in China. And so we weren't able to have a system to either talk about or to work on the problems that come up from a psycho-emotional separation of mind and body that is prevalent in Western civilization. And then I came across Dr. Gabor Mate. I really resonated with his work, and that's when I fell into doing the full training of CI. So I did the 1 year online training and then the 6 months mentorship. And so now I'm a certified CI practitioner, and I incorporate that now with my Chinese medicine practice.
For me, it was much, much later in my career. So I previously had a career in aviation. So it was interesting. I was studying all the systems of an aircraft and working as a pilot on a 737-800 for a very big airline within Europe. And it was very interesting. While the job was very interesting, um, it also had its challenges, with shift work and how it was affecting my body systems. So I was attending an acupuncturist to keep me in balance for my work. And so knowing how good acupuncture was working for me on a personal level, when it came to the time that I felt it was ready to leave aviation, it just seemed like the next step would be to go into studying acupuncture and the systems of the body as opposed to the aircraft. But while I was in the flying industry in aviation, I was always very curious and fascinated by all the different personalities and how people reacted to different situations. Of course, we had to do training in emergency situations, what we would do, how to
Mhm.
stay calm, all of that. And I became an instructor on the aircraft in the simulator. And that also was showing me how people were reacting differently. So I found that really fascinating, and I wanted to study more into the psychology of the mind and what makes us tick. That curiosity brought me more to shamanism. And it was one conversation I had with my shamanic practitioner, Martin, and we were talking about the different realms, and one of those being the realm of the hungry ghost. When I Googled it, turned out to be the name of one of Gabor Mate's books. Whilst what he was doing was very simple, it was getting very deep with people. So I was just noticing that he was going more into what was being held in the body rather than trying to mentally work something out with people. And that's what brought me to compassionate inquiry.
I don't think we recognize how culturally based TCM is. So it might have been the shaman, or it might have been the Taoist priest, or whoever it was that was giving them ritual and ceremony, and as I would say, is probably was guiding them to re-meet their own soul and making sure that that relationship was there. As we've lost that in our current society, we have to re-find a way to do that. And I think that's always the counterpart to the TCM that we've all studied, is that we're missing that guide or that elder to help us meet our soul.
So I would say CI is more bottom up orientated, whereas the other approaches might be more top down,
Yes.
especially if we're comparing it to psychotherapy. That's
Mhm.
how I would see the difference. We are going to the wisdom of the person. The questions we're using are to bring the client to their own inner wisdom.
Yeah.
Where I would say some of the other modalities is using the wisdom of the therapist.
Some tools that we can use at different moments. It's not a protocol of we go through step one, then step two, then step three, then step four. There's a movement and a fluidity of almost like a dance with with the client.
Well, it's only when that safety is present that the client or any person will allow themselves to come to the truth. And it's getting to that truth that's really liberating.
For example, in front of me right now, I had a patient who I've seen her for quite a long time, and I started seeing her before I did CI, and she's been coming for at least 7 or 8 years. And so recently she came back for a hip problem. She has very tightness in her hip. And so in the past, and always to start with, I'll do some distal needling, imaging and mirroring, right? So I'll look at the hip, I'll look at the shoulder or the ankle or the wrist, look at the interacting channels, do the imaging, and there will be some relief. But what I noticed is after maybe 2 sessions, the relief was very short-lived. And so either I would have to see the patient 3 times a week for a period of 3 weeks to get over it. But the patient didn't have that type of time, the ability to come in that often. So we started doing a CI treatment, a CI session to begin with. And we went into her body, into her hip, and without going into too much detail on her personal story, the main emotion that arose was fear, a fear of many different things, basically based on her parents, etc. So the treatment was a dispersion of the kidney channel based on the 4 needle technique, which would not make much sense from a pure biomechanical point of view. It wasn't the kidney that was affected. It was more the gallbladder and it was the liver, but definitely not the kidney, etc. After that treatment, the next day I get an email saying it's the best she slept in weeks. She woke up and the hip was much better. And then she came 2 weeks later. So not even a week later, 2 weeks later, there was still a lot of improvement, even though the hip was still there. The treatment lasted longer. The next treatment, we went again into it. And what we noticed is once the fear was gone, there was a desire to be angry, but she wasn't able to express her anger. She wasn't able to say no.
Huh.
So in this treatment, after going through the CI session, we then tonified the gallbladder from the 4 needle technique. So, and again, she wrote me after, sleep much better. I'm going to see her this week because I was on holidays last 2 weeks. But that's an example of how your you can use what comes up in a CI treatment. And even though it wouldn't necessarily make sense from a pure channel approach or from a biomechanical approach, the psycho-emotional aspect or the emotional charge that can either be released or the unexpressed emotion that can be supported allows for that aspect to be released. So that was one example of how CI gave more depth to a treatment.
And I think that helps, about so the acupuncture points are really helping with the flow of the chi. But when I can bring my mind into balance with that, I'm getting a much deeper treatment.
Yeah. So you're coming back to that idea of yi, intention, guiding the treatment. And when the client is able to change their mindset or their perception of what's happening, there's a more of an opening for the acupuncture to even go further and deeper because
Yeah.
in Chinese medicine, we talk about the yi or the intention changing with the client.
Yeah. And there was one recent client who had really bad psoriasis on his hands and had tried this and this and this, and the acupuncture was helping, but it still kept coming back, as you already alluded to earlier. And we talked recently, and he said that what made the difference was learning to say no.
Oh,
His
excellent.
pattern from the past was become the pleaser. I must do what you want. And when he found his voice to say, no, this is not suiting me right now, or no, I need to do something else, that shifted so much for him.
Excellent.
Mm.
It takes a lot of bravery for for as the practitioner to go deep into the place with the person and stay upright and present and compassionate and open. And at the same time, not over mothering or protecting.
The outcome is not to have the person feel better.
Mm-hmm.
If they do, of course, that's great,
Yes.
but not the agenda. It's
No.
have them get better at feeling.
Yes, that's the famous Michael Brown quote is
Yeah.
it's not the goal of our treatments is not to help get the person to feel better, but to get them better at feeling. So, one of the key questions we ask the client is, who did you talk to about this? 99% of the time is, I didn't talk to anyone.
Yeah.
Or if they did talk to someone, it was about the facts, but not about the emotions.
Right.
And so for sure is that the fact that the therapist is now there, giving them that person to sit with them and talk about it is a huge healing moment for the client themselves. And I think that's a big part of where the safety and the attunement that the practitioner offers is that now there is another person that can sit with them through their emotional, and they're not alone in it. Because one of the greatest, this idea is the greatest fear of a child is to be alone with something.
Yeah, absolutely. And that's so key in compassionate inquiry is that we stay with that emotion so they get to express it.
Exactly.
Stay with them in that. Yeah. Which again goes back to leaning into we have to have our work done so that we can be present. So we're not afraid of the pain. We're not afraid to be with the pain.
Mm-hmm.
And then our nervous system is sending a message to their nervous system and they'll feel that presence with us.
Right.
I think it was Ram Dass spoke about fierce grace.
Yes.
And I've heard Gabor saying we come with fierce
Compassion.
compassion. Yeah.